When Don started the company, and I was with him in the early days, it was really, a very small handful of people who really got that the greatest untapped resource in the healthcare system is you and I. It's the individual, because on any given day we're managing, so many different health problems.
In 1971, I was a lieutenant in the U.S. Public Health Service. One day I went to a talk by an assistant secretary of what was then Health, Education, and Welfare, Vern Wilson, who said that the greatest untapped resource in healthcare is the patient. And that was just kind of the idea. That was the aha moment. It said, all right, my career is going to be focused on tapping that resource, helping people to make better health decisions. We have a very simple mission: help people make better health decisions.
I first met Don sometime, probably about 1978. I was in my earlier life at the YMCA. I was a health and fitness director, and Don was the CEO at this young company called HealthWise. And for the first time I met him, I just thought, this guy's a visionary.
Don is an upside down thinker, I say, because he often looks at problems from the reverse of what others do. And the very beginning of HealthWise was upside down thinking and visionary. Instead of saying it's the doctor's responsibility for my health care, he turned it upside down and said the patient needs to take some responsibility for this. So it's to see that 30-some years ago and work on it as long as he has, to me, is truly visionary.
I came to Boise right out of a master's in public health at Berkeley, and I landed at the airport, and my prospective employer met me in his cowboy boots and his pickup truck, and he had just come from a meeting with the governor. And right away I thought, maybe this is a place where you can get something done.
He moved here from the South, from his early beginnings, and he found this incredible culture, within Idaho. It was a really healthy place to grow a family, at least initially, and then to build a workforce for it. So his vision really is that literally everybody ought to have access to healthcare services first, but more important than that, that they ought to be able to do a lot for themselves, in terms of self-care.
What is so wonderful about having HealthWise beating heart here in Boise, Idaho, is that our employees kind of suck the marrow out of Idaho life. We've got bikers and campers and triathletes and people who are really committed to enjoying the natural splendor that we have here.
Way back in the early days of HealthWise, it was pretty much Don and I, and we would do these presentations to small groups, from here in Boise and in Idaho to all over the country. And he used to have this shtick where he would say, hold up a bottle that looked like a bottle of medicine. And he said, if you took this pill, this would entirely cure whatever illness ails you. But you have to take this pill according to the following conditions. You have to get up and exercise 30 minutes before you take this pill. You have to eat a nutritious breakfast. You have to be hugging a significant other or a spouse. And you have to be able to take advantage of connecting with many other people on that daily basis and making a connection with them.
The first things we did were to create workshops to teach people about stuff. And then we began to think, this isn't very scalable, bringing these folks in. We need to create a book. And the book that we created was the same concept that I had envisioned years before, which was to provide a basic self-care guide for people.
Our first tech innovation was a green 3-ring binder that held together mimeographed sheets of consumer health information.
There's so much more in healthcare that people can do for themselves. So helping people learn what can they do for colds and flu and headaches, when do they need to see a doctor, how do they prepare for the visit and get their money's worth when they go. And we put all of that into the first edition of the HealthWise Handbook. It's now 18 editions later, and that book has been used by over 33 million people. The HealthWise culture is no accident, that we work really hard to create the culture.
The culture that we have at HealthWise very much is in support of the employees. The employees tell us they want flexible work time, that they want to wear casual dress, that the dogs in the office are a huge boon, that they like being able to go for walking meetings.
Don has been consistent, in both his values, his integrity, his vision, and his mission for all the years that I've known, which is now over 30 years. We were founded as a not-for-profit organization, and Don has really stayed true, to that agenda that really builds a culture of helping people stay focused on the mission. And it doesn't mean that we're not for money. It's just what we do with our assets, that's quite different. And so if you think about a guy who really established this company 4 years ago, has had huge opportunity to really cash in, if you will, his real agenda has been about, making a difference, putting a dent in the universe around people making better healthcare decisions.
I think there's something to be said for sort of an Idaho attitude or an Idaho frame of mind that says, we live in some of the most beautiful country in the world. We would be fools not to take advantage of it.
So early on, we began to develop this relationship with the technology sector in Boise. And we've seen it grow over these decades to become one of the best places to work and play. Idaho's still a great place for innovative IT companies. We've got a culture of collaboration where the companies are working with each other to bring their advances forward.
I think what he's brought to Idaho is a phenomenal world-class company. He has walked the talk. It's the healthiest place to work in this community.
There's an openness, there's a flexibility, there's a desire to make this a great place to work, and great places to work can help inspire great ideas.
But there's another side of our culture, and that's the culture of innovation. And we try to encourage innovation from every position. With information therapy, it was clear that getting the information from the doctor to the patient is great. But then we realized that's only half the job. If you really want shared decision making, you have to get the patient's response back into the clinical record and back to the doctor. So that's another technological advancement. How do you get the patient's voice embedded back into the clinical record? And we've done that with 13 of the most successful electronic medical record companies in the country. The biggest challenge to healthcare IT today is interoperability. How to get the different systems to talk with each other. We look at that from the perspective of the patient. How do you give the patient in one voice and in one view the information from all the care teams, and then how do you share back to the care teams with the patient's voice and the patient's view?
The material we write to help people make better health decisions. And the technology we use is all around how can we make this technology work to serve our mission, to help people.
Any change in technology we view from the perspective of that mission. Will this change help us help people make better health decisions?
Don is a man of many parts, and probably one of his biggest shiny parts is his vision.
What Don brings to the table that inspires us, I think, is just this amazing vision and an unwavering vision. He's a big dreamer. He's a person that brings people together. He aligns you around that dream. So they start as Don's dreams and then they become your dreams.
We've used the word visionary, and Don is someone who has set a direction for an industry that no one else could see at the time. He is able to take an organization and turn it into a cohesive group of people who are going the same direction and are passionate about it.
So people ask me, what's next for HealthWise? And here is the vision, and it's just beginning. That there is a huge change going on in the way we're paying for healthcare. With that change will come the opportunity to look at all the things that impact your health, not just the test you need to take or the drug you need to take or the surgery you need. And we're looking at creating something that I would call My Care Plan, which looks at all the aspects that impact your health and making that available for every person. I encourage you to think of Alan Kay's quote, that the best way to predict the future is to invent it.